Hey, welcome to my channel. I'm Marion McRae, physiotherapist, back pain specialist, and founder of the Bulletproof Backs Method. If you're here, I'm assuming it's because you're ready to take charge of your back pain and hopefully discover some holistic pathways to healing that combine mindset, movement, emotional fitness, and some lifestyle strategies. Welcome to Ask the Back Pain Coach, where I answer your most pressing back pain questions straight from the heart without getting in my head and overthinking, and just backed by years of experience. I find I do my best work when I don't overthink, when I literally just speak from my heart. With that backing of knowledge and experience, usually that's the most impactful advice I can offer. So that's what I'm attempting to do in these question and answer video series. Before we do dive in, though, a quick note. The information I share here reflects my personal opinions and experience as a physio. It's meant for educational purposes only, and it isn't a substitute for advice from your own healthcare team. I encourage you to consult your doctor or therapist to tailor these ideas to your unique situation. So, with that being said, let's get started on today's question. Today we have Alejandro. I'm probably saying that wrong. I apologize in advance. Hi, my name is Alejandro. I'm from Barcelona. Wow, we're getting some diverse inputs here. I love it. I've had, which just goes to show, right? Back pain doesn't discriminate between countries or races or sexes or ages or income streams. It just affects everybody. So I have a lot to say on it, which is why I have this channel. So bear with me. I've had lower back pain for 5 years now. That's a long time. Ever since I started training intensely for triathlons. The doctors say it's a combination of tight hip flexors and bad posture on the bike. I've spent thousands, whoa, on massage therapy and custom orthotics. Interesting, but nothing sticks. A friend in my training group mentioned your channel and how it helped him, so I decided to check it out. It's been eye-opening, but I still feel stuck on how to make lasting progress. Hey, thanks. Thanks for reaching out. The fact you're a triathlon tells me a lot about you. I consider myself what shall I call myself? Um, nah, I would say, well, a master's athlete. Let's just say that. Uh, I am always competing at something because I like to set myself challenges and then that stretch me and then work towards them. So I understand that triathlon is, a really great pastime because the reason I really like it is because it combines run, swim, bike. So your body's getting conditioned in three different movements. The only issue with it is that those movements, apart from how you swim, are quite frontal, a lot of flexion extension. There's not much lateral flexion, and there's might be some rotation when you swim, but the running and the bike are very unidirectional. And given the length of time you do them, even though it's movement, it's loading two directional movement predominantly 80%. And then those other variations aren't really getting a look in. So there's a few things that I would bring and discuss about with this. Before we go there, though, you've mentioned the doctors say it's a combination of tight hip flexors and bad posture on the bike. Again, is that the doctor's opinion only, or have you sought some input from some other modalities like physio or like a coach? Have your hip flexors actually been tested? Are they actually short? Because we can measure them. And so if they are, then yes, I'll validate that. If they're not, then we're probably not on the money there. And bad posture on the bike. So I'm assuming by bad posture, they're referring to the posterior tilt, the lean forward position. And as possibly what's going on, but I guess the only way you know, Alejandro, is when you're on the bike, is it hurting? If you're in that posture, does it hurt? Because if it does, then yes, it's probably related. But if it's not hurting when you're in that position on the bike, I would say then that's not the issue. Usually the pain guides us to the postures and positions it doesn't like. So let's not assume that that flexed posture is bad unless it's causing pain. You might actually say, well, actually, it's when I'm swimming that the pain's worse, in which case the back is letting us know it's the extension it's not enjoying, not the flexion. So there's so many ways to explore this. I just want to give you some things to think about and some assumptions to question. You've spent thousands on massage therapy. And I guess, what you've learned is that that might be giving you short-term relief, but it's not getting to the root of the problem. It could be, though, that if you hadn't spent thousands on massage therapy, you'd be a lot worse. So it might be part of your solution, but not the whole solution. And custom orthotics, that's interesting. I'm curious as to why you tried the custom orthotics. Were your feet causing any problems? Was there any issues with your lower limb alignment? Because if not, I'm not big on orthotics. If something's not broken, don't fix it. So there needs to be a really valid, real explanation for the orthotics, in my opinion. I think a lot of people get given them in the hope that that's going to ripple up to the back and create some relief. And possibly it does. And the way to know is if you're walking around and your back hurts and you put the orthotics in, does it feel better? And if it does, then again, that's something that you may put in your toolbox. The problem with wearing orthotics when there's nothing wrong with your feet is that the muscles and joints in your foot have no longer anything to do. So they go on holiday, they get lazy, the joints can get stiffer, the foot intrinsics can get weaker, and then your general foot function can deteriorate, which means when you're then running and your foot's not prime, the impact force that your foot's meant to be absorbing can no longer do its job. So just think about those things as well. I would rather train a foot to do the things it's not doing than rely on an orthotic. But often, in a practical sense, the middle road is the most useful. Use the orthotics for when you're on your feet and you're in pain, when you're at home and able to strengthen and activate your feet, get them out and do that so you're getting the best of both worlds. Okay, so basically, let's think about this. If you're going to be a triathlete, you're going to move a lot. You're open to strength training. You clearly know how to push your body into intensity and you're driven and you're committed. So the next part of the puzzle that I would really encourage you to learn would be understanding pelvic motions. There's 8 movements a pelvis ideally gets to experience every day. I suspect yours is getting 2 of them 90% of the day. And the others are probably not happening very much at all, and certainly not to the extreme that the other 2 are getting. So I would be leaning towards thinking this is a lack of movement in certain directions and areas, but an overloading of movement in 2 zones. And the 2 zones I think you're probably getting a lot of is anterior tilt, posterior tilt, perhaps, or certainly hip flexion and hip extension. The movements I feel you're probably missing out on is pelvic shift, left and right, hike and drop, and rotation. When you get that level of movement going on in even balance through your body, I suspect it's going to take a lot of heat out of the overuse that you're experiencing in the zones you're experiencing them. So I have a video on the channel talking about the 8 pelvic motions. That'd be a great place to start. Just sort of explore. Can I move my pelvis in these 8 ways? Obviously, we all have movement directions that we are more familiar with, and I would encourage you to spend a lot more time imprinting in your brain the ones that are less familiar and make them more familiar. So that, for instance, when you're on the bike, and if there is pain in your back in that position, then you could learn how to hike or drop from a flexed position, or to rotate left or right from a flexed position. And you could be feeding those micro movements into your back while you're doing the cycling. And the back pain, if it's present when you're on the bike, it's going to tell you what it needs. So if it's sick of flexion and you extend it, it's going to feel better. If you're take it into a bit of right rotation, and we're talking a few degrees, then that's going to create a completely different load stress pattern in your back in that moment, which will either relieve or exacerbate the discomfort. And you know then which way to take it based on the movements and what your spine, how your spine reacts with the pain. But you can't have that thought process if you don't know the movements to feed it. So I would really just start to explore how your pelvis moves in space. The upside is it is going to give you an empowered choice over the pain in the moment that you're competing, so that if something's hurting, you can go micro move in the opposite direction that causes relief and keep going. That's a lot of what I taught my body to do when I was ultra running. And, some of the events I did were for 24 hours, and you can't move for 24 hours without pain building in some part of your body. But learning in the moment how to deload it through a subtle pelvic rotation or a change in the flexion angle that from the outside looking in, nobody can tell, but you're in your body knowing you've micro-tuned it, and that gives you another 10K without pain in that area. It'll build somewhere else, but then you micro-tune it back. And it's that game of like, oh, it's building here, take it out of there. Oh, now it's coming here, take it out of there. And you can only learn that level of mastery of movement within your own body by doing these long, long spells of repetitive movement. So it's the biggest investment I think endurance athletes can learn is how to move their pelvis. So start with that process. So the two things it's going to give you is one, the ability to compete and turn the pain off. And two, it will actually ultimately improve your performance, because the more choice we have in how to coordinate our rib cage and our pelvis and our feet and our shoulders gives us more efficiency. And triathlon performance is about efficiency. You don't want to be working and muscling harder. You want to be finding ways to hold the same speed with less activation. And that's what I talk about, movement efficiency. And the best place to start with that is by learning and exploring your 8 pelvic motions. So I hope that helped. There's so much out there for someone like you, Alexandra. I just can't say your name, I'm sorry. But yeah, I hope that helped, and thanks for reaching out. Hopefully maybe perhaps I can do a video on that upcoming. Okay, ciao.